Cyanotic defects are when the blood pumped to the body contains less than the normal amounts of oxygen. This causes the skin to turn blue, which is called cyanosis. One type of a cyanotic defect is the Tetralogy of Fallot. This defect is composed of 4 different defects, which makes the oxygen level too low. The first of these defects are a large hole in the wall between the 2 ventricles, called a ventricular septal defect. This allows oxygen-poor blood to mix with oxygen-rich blood. And in the diagram, you can see that it is this defect here. The second defect is a narrowing at or around the pulmonary valve. So this one right here. This blocks the flow of blood from the right side of the heart to the lungs, which makes the right side have to pump harder to try to get the blood to the lungs. The third defect is a more muscular than normal right ventricle. As you can see, the muscle in the right side is unusually thick. And the fourth defect is an aorta that lies directly over the right ventricle. This allows oxygen-poor blood to flow into the aorta. So you can see right here. Some of the symptoms of this defect are a bluish coloration of the skin, which signifies low oxygen in the blood, shortness of breath or rapid breathing, loss of consciousness or fainting, clubbing of fingers and toes, which are like abnormal rounded shape of the nail bed, poor weight gain, tiring easily during play or exercise, irritability, prolonged crying, a heart murmur, or tet spells. Tet spells are when there's a rapid drop in the blood oxygen, usually after crying, feeding, or agitation. And it's most common in babies from 2 to 4 months, because older kids know when to sit down or squat when they're short of breath. Some of the risk factors of this defect are a viral illness during pregnancy, for example rubella, alcoholism during pregnancy, poor nutrition during pregnancy, a mother older than 40 years old, or a parent with Tetralogy of Fallot as well, or the presence of Down syndrome or DiGeorge syndrome. Down syndrome is when you have an extra chromosome 21, and DiGeorge syndrome is when you have a defect in the chromosome 22. And this here is a child who has DiGeorge syndrome. Some of the treatment methods of this defect are intercardiac repair, which is open heart surgery, usually done during the first year after birth. You usually place a patch over the ventricular septal defect to close the hole between the ventricles. You'd also repair or replace the narrowed pulmonary valve, and you would widen the pulmonary arteries to increase blood flow to the lungs. Another option is a temporary surgery, usually done for premature babies, because they are too young and too small to do the intercardiac repair. This is when the surgeon will create a bypass or a shunt between the pulmonary artery and a large artery off the aorta. This increases the blood flow to the lungs, and when they go to do the intercardiac repair later on in life, they would have to remove this shunt. So you can see here that they connect the pulmonary artery, which is this one here, to one of the arteries in the aorta. Some of the complications after surgery are chronic pulmonary regurgitation, which is when blood leaks through the pulmonary valve back into the pumping chamber, the right ventricle. Another complication are irregular heartbeats, and another one is aortic root dilation, which is when the ascending aorta enlarges. As you can see here, the aorta has puffed up, and this is what a doctor or surgeon has done to repair that.